we have the finest products in front of us with the Inno-Vita line that Dr. Kim has developed, and I believe them to be highly, highly valuable in our practices for not only feeding the organs and glands at the level of the DNA, which is so important to keeping our health important, but also to keep us getting the chi flow to the organs and glands. And many of you that may be listening are not aware that not only are these formulas working at the cellular level, but they're also promoting the acupuncture system's ability to work in a form of what I utilize as a form of needleless acupuncture. And I'm sure many of you other practitioners may be using some form of applied kinesiology, which is basically a needleless form of acupuncture. Well, these formulas do just fantastic things for opening up chi and keeping the organ or gland not only stabilized at the DNA, but keeping that chi flow going so that you don't need a lot of extra oriental herbs to do the same thing that these formulas do. A little bit about myself. I have a clinic in Erie. We are the first naturopathic clinic in northwestern Pennsylvania. I have about 12 or 13 practitioners working out of it. Dr. Kim was gracious enough to come and visit us last February and give a wonderful presentation. And we have a classroom, and we have colon hydrotherapy, massage therapy, reflexology, cranial sacral therapy, naturopathy, acupuncture, mind-body integration, and the colon hydrotherapy, of course, is just, I cannot be happier to have that. And this is a wonderful connection of networking with various practitioners. So when I come to you today with information, I'm going to be talking to you a lot about how we as practitioners need to look at probably one of the most important pathogenic ills in our society today, and that is parasite infections. 65% or more, and I'm really thinking it's probably, if we really knew the whole story, probably closer to 70 to 75% of the populace has been dealing with parasite infections that are creating all kinds of conditions, from fibromyalgia to chronic fatigue to IBS, and you name it. We're going to be talking about some of those things tonight. The big thing as practitioners, what we need to be able to do is recognize this may be the critter behind the problem that we need to get rid of. I'm going to kind of start tonight with the hidden epidemic of parasites that we're going to be discussing. And the hidden epidemic of parasites, we're going to be going through the species, the parasite symptoms, prevention, and the Inno-Vita protocols. And I'm going to start tonight with one of the most important things, and that is the species, and knowing what species indicates what type of worm. Cystota, which would be the flatworms that are tape, which are usually gut-dwelling and absorb their nutrients through the skin, and you can see what these worms look like. The tapeworm, of course, is very commonly found in animals, and they quickly present, as you will know, if you have a dog or a cat, and you see a very flat-looking, what looks like a piece of linguine in their stool, you can know that that animal is being infested by a tapeworm. Also, you'll see on their bedding many times these little segments that look, once they're dried up, like little pieces of brown rice in their bedding. That's another indication your animal has a tapeworm, a cystota. And when you know this, it's important not only to get the animal wormed specifically for the tapeworm, but to also make sure that you don't have a tapeworm. And you might want to examine your own stool or realize, you know, the symptoms, which we're going to be going over during this presentation. Tapeworm is, believe it or not as serious to an animal as it is to a human. They tend to grow, they have eggs that hatch, and these eggs can move throughout the body, and you can get them in organs and glands, and that's where the problem begins. The next one we're going to talk about in the species is the nematode, known as nematoda. It is a roundworm, And it's most diverse of all animals, and though not all parasitic, some estimates are that there are as many as 500,000 various roundworms. Pinworms, of course, would be included in this grouping, and this is something many children get, you know, as you're dealing with anal itching and whatnot, and needs to be addressed. And, of course, the roundworm itself, the hookworm, are other common nematodes, and obviously need to be addressed, and there are numerous ways to get rid of them. Using the protocols that we're going to be getting into, we're going to be basically talking about the two basic parasite cleanses that we have in Inno-Vita, which would be the microsite and the Paramac. And, of course, Paramac would be your larger worms, your tapes, your Cestota, and your Nematoda. Those would all be categorized under the vial if you're using the vials to check with the Paramac parasite formula. And and of course, my suggestion is always test with vials, because there's just no better way to do it. We'll get into that a little bit later in the program. But this is a great, great formula. I've had many of my patients come back and say, wow, I saw worms in my stool, and usually there'll be, again, kind of a flat linguine-looking Cestota tapeworm, or sometimes the round worms that are long and spaghetti-like in some cases, or little white thready-looking things that are very small and thin, and they will see them in their stools. So it's not anything unusual, but realize also that Dr. Kim has organized within these formulas both bromelain and papain, which are obviously proteolytic enzymes, which actually digest the dead parasites, as well as the toxins they release, which we'll be getting into, and these are what we really need to be most cognizant about. Next, we're going to talk about the protozoans, and these are unicellular microorganisms which have obtained a different classification due to their flagella. Remember, they have the little tail. They are seen under a microscope and are found in a range of over 3,000 variations, and they are your Hamida histolyticas, your Endomylax nana, which attack the collagen, your Gerardias, your Cryptosporidians, your Blastocystis hominis. These are all protozoans that need to be eradicated, because these are really the tough ones to get rid of. It's actually, I tell patients, it's better to have the larger parasites. They're easier to get rid of. They're easier to kill. The protozoans have a great ability to hide in the spinal fluid, in the cell matrix, and they can hide, and they're difficult to eradicate. And sometimes I've seen people that have been on these formulas for months to get rid of them, because they bury themselves in the cells and hide, and obviously are difficult to get. Our formulas, I believe, are the best, and oftentimes with this type of parasite, you will notice symptoms from patients, specifically arthritic, and that's because they can get into the collagen, which we'll be talking about, and into the joints. So this is one little hint I'm going to tell you right off the bat to be aware of. The word protozoa is Greek for first animals. Intriguing. These are also creatures that come from water. You've heard of Montezuma's Revenge. Anything south of the border, be careful what water you're drinking, because this is the kind of parasites that are picked up typically. The trematodes, let's go to them next. And the trematode is a parasite with a complex life cycle that are commonly referred to as flukes. You may have heard of liver flukes. Contrary to the Cestota, the trematode has a gut within a mouth on one end and an anus on the other. So they're an intriguingly unique parasite. They are found in the bile ducts. They can literally plug the bile ducts of the gallbladder and the liver and make you very sick. If you have a patient that has a trematode, you want to get rid of them. Also, there is a particular type of trematode that is the part of research by Hulda Clark, who wrote The Cure for All Cancers. And any of you that have read that, this particular fluke is a preeminence to cancer, and many times once the fluke has been killed, the cancer goes away. And she had 500 case studies of even stage 4 cancers. These flukes, this particular type of fluke, and it's a very, very bad fluke to have. So whenever you find a patient that is testing strong for the microsite, you might want to even ask the question as you're testing, is this a fluke? And you don't have to say it out loud, you can muscle test. And as a consequence, if they test strong that it's a fluke as opposed to a protozoan, you might want to let them know this is a very important parasite to get rid of. This is probably one of the more dangerous ones, simply because so many cancer patients carry this particular fluke. So we want to be aware of that. The parasite symptoms we're going to talk about next, and many parasite symptoms go ignored as, oh, I just ate something that wasn't very good, or, you know, my digestion needs work, or I've had some diarrhea or whatever. But we always want to be aware that in a parasite issue, there is kind of this balancing back and forth between, believe it or not, constipation and diarrhea. That is one of your first symptoms that this may be parasitically involved. If the person presents symptoms that say, well, gee, one day I have constipation and then a couple days go by and then I have diarrhea, that's kind of a red flag. This is more than likely a parasite infection. In addition to that, gas and bloating, really common with parasite infections. And I'll tell you an interesting story. I had a patient come in that her mother was convinced she was pregnant. And she was a long-standing patient of mine, and the irony was her husband had had a vasectomy in a previous marriage. So the question was, well, why hasn't the husband been checked? But they weren't thinking about that. They thought, well, maybe something happened, and his vas deferens somehow or other reconnected. And she kept getting bigger and bigger. And she finally went to the doctor. They did an ultrasound. There was no baby, but there was still this bloating and getting bigger and bigger. Finally, her mother said, you need to go in and see Dr. Gay and see what may be back of this. She did, and guess what I found? A protozoan. She was loaded with microparasites, and I got her on the microsite formula. She came back a month later for her follow-up. Stomach was completely flat. Here, this gas and bloating was so enraged, and that's the best word I can come up with, that she absolutely was wearing maternity clothes. So be aware that gas and bloating that distends that abdomen to an unusual size in anybody is another big indicator. They more than likely have some kind of a parasite infection. That's a big red flag. Probably one of the biggest. And if you see children with bloated bellies, that would be an indicator, again, of parasite infection, or adults. It's more often that than anything else. IBS and Crohn's. Many times Crohn's disease is, oh, well, let's treat it with steroids and let's put you on all these kinds of drugs, when the reality of it is if the doc looked behind the scenes, he would find a parasite infection, or she would find a parasite infection. IBS, same problem. Irritable bowel syndrome is so common and so many times associated with a deep parasitic infection that even despite the fact that there's been a scope of the colon and rectals and everything else, they've missed it. More often than not, because the parasites can hide. I had a patient that came to me that was convinced he was on his deathbed. He was eating nothing. He was having to juice his food in order to digest it. If he didn't, if he tried to eat anything, he'd get horrible gastric pains, and he was taking enemas essentially almost on a daily basis just to get his his colon pushing out the waste. He was sick all the time. He had been to a gastroenterologist. They found nothing. They basically diagnosed him with gastric paresis. So if any patient comes to you presenting symptoms of gastric paresis, be aware there is a neurotoxin that is exuded by these parasites that can very much affect the ability of the gastrointestinal tract to allow peristalsis, which means the movement of food down the alimentary canal, to properly engage. And gastric paresis means that that is not occurring, that it's essentially in either slow-mo or not moving at all. So be aware gastric paresis may be a sign of issues of parasites. What I had him do is use a parasite cleanse in an enema bag, because I didn't even dare start giving him a parasite cleanse because it would have been too much for him. He not only presented Paramac as a problem, but microsites. So he could have had all 4 of the species. And he exited literally sacks of tapeworm and roundworm. And he was so overwhelmed, he called me and he said, "You will not believe what's in my toilet." And he said the odor was just overwhelming for him. So that was a really unique story. And from that point on, he was able to eat, and he was able to digest his food. And we started him at that point on a progressive oral parasite cleanse. So remember that. If you have someone that is showing tremendous illness, this guy was really about ready for a coffin, and he knew that, and they were not giving him any hope that they were going to be able to help him medically. That you want to proceed very conservatively, and I would really recommend start with the parasitic enema. You're just breaking up the parasite formulas, maybe 4 in capsules released in a bag, and just shoot it up the rectum, because that would be the best way to start. In other words, kill them from the inside. You can also, remember, use 2½ cloves or 2 cloves that are smashed of garlic in warm water, and that's another great way to get the parasites exiting. Coffee enemas are a great way, and you want to go half coffee, half warm water. And you can also do the same thing with the apple cider vinegar, half and half, to kind of open up the colon and get it moving. And sometimes that's the best place to start, is get the colon function moving if they're really in a state of illness. Joint and muscle issues, arthritis, fibromyalgia. Oh, another big, huge red flag. The first thing I look for when I am screening a patient is when they present symptoms that are listed on their intake form of arthritis. I had a real serious case of arthritis come 2 years ago, and she came into my office and she said I'd been back and forth in and out of a wheelchair, unable to work. She'd been to Cleveland Clinic. They had her on methotrexate, believe it or not, for rheumatoid arthritis, which was diagnosed. I tested her and I said, "Boy, did somebody screw up on your diagnosis." I said, "Energetically, what I'm finding here is tapeworms, and we need to get them out of your system because that's probably what's causing your arthritis." She came back for her follow-up visit in a month with a big grin on her face. She said, I haven't felt this good in 14 years. And we proceeded to clean her out of the parasites, and there was more than one infestation, and she is now, believe it or not, back to work. And if you go to my website, you can read her testimonial and many other testimonials with these parasite infections. Just the arthritis, the muscle issues, they'll present symptoms of joint and muscle pain or aches, and the common thread is, "Oh, I feel like I'm 90 years old." You'll hear that over and over again. And when you hear that, another red flag that this is more than likely a parasite infection involvement. It doesn't always have to be, but if you're using any form of either diagnostic testing through a lab, be aware that this is one of the first things you should look at. And of course, if you're using, and many of you do, applied kinesiology, a biggie, because you can test with the vials on the colon. When we get into the vials, I'll tell you some unique things that I have found that I can test specifically with. Number 5, ADHD, hyperactivity, inability to concentrate. The parasites exude a neurotoxin. This neurotoxin is literally embracing your neurological system and making it do things that it wouldn't normally do. I always think of it as a short circuit in the neurological system. Think of your breaker box suddenly shutting down, and that's exactly what happens with these neurotoxins. They exude, these parasites, especially the larger ones, these horrible neurotoxins that can cause anything from seizures to mental lapses, brain fog, inability to concentrate, neuroses. Literally, I've seen bipolar patients with strong parasite infection issues. A relative of mine, a cousin of mine, had an aunt on his side that lived in Japan. And, of course, they eat a lot of sushi over there. When she came back to the States, she started presenting mental issues that they absolutely couldn't figure out what was causing them. And in later years, I said to him, you know, I really think your aunt has probably been a victim of a parasite infection that affected her brain. And they had her on they had her on lithium and everything else. Now, we'll never know whether that was what exactly caused it, but looking back at her history, I would guess that was what the issue was. Inability to concentrate is another biggie, and you'll hear that a lot associated with thyroid, but realize that the parasite waste also affects thyroid and endocrine function, which is really important. Hyperactivity, oh my. I can't tell you how many patients I've heard, gee, I can't get to sleep at night, Dr. Hilton, I am awake, I drop things, I can't seem to keep my hands from shaking sometimes. Neurological imbalance is a big thing, and anytime a neurological imbalance just creeps up and it presents, that's one of the first things I look at. ADHD, I see a lot of my young patients with these issues being presented, and I find a parasite. So again, these are something, this doesn't always happen to be a parasite infection. Sometimes, of course, we know it can be vaccinosis, issues associated with heavy metals, and a number of other things, including virus and bacteria that can cause this, which we would obviously be screening for if we're using applied kinesiology. Many parasite symptoms go ignored, so let's continue on. Depression, suicidal tendencies, anxiety. One of the biggies, again, that's a red flag is when someone comes in presenting symptoms of, gee, I have this unbelievable depression. I don't know why. It just started all of a sudden. I seem to have no control over it. I'm taking all these different medical drugs that they have grouped, and I've tried this drug and I've tried that drug and nothing's working, and I'm still depressed, or it works for a while and it's not going away, and it comes back. So that's again a big red flag that again possibly the neurotoxin. Remember, neurological, depression, they go hand in hand. Suicidal tendency, this is one of the things that I have found in my practice to be just scary. My next door neighbor, who was very famous, committed suicide a year ago, a little over a year ago. She had been to the country Moldova in the Peace Corps. And when I had tested her in 2004, I had found parasites. I had put her on a cleanse, and she had presenting symptoms that were just unbelievable. And they were so parasitic it wasn't funny. She had animals living in her home and loved animals, and had, at the time, 4 different types of animals. You know, one was caged, and she had cats and dogs and whatever. Obviously, probably wasn't washing her hands enough. Presented initially symptoms of sleeplessness and anxiety, and the sleeplessness just got worse and worse. the anxiety went with it, and she was on Effexor, which was doing nothing for her. And I said, we've got to get rid of this parasite infection. Well, we got rid of the parasite infection, and then she takes off and goes to Moldova for a year and 3/4. This was absolutely the worst place she could have gone, because if any of you know where Moldova is, it's a small, very third world country between Romania and Russia. They sometimes go a whole week without electricity. There's animals everywhere running the streets that are skinny and dying, and she was taking some of these animals in to try to save their lives, and obviously picked up a very bad infection. Came back, was relying on wine to get her to go to sleep, and ultimately, after just having a myriad of symptoms, everything from muscle and joint pain to neurotic thinking, obviously anxieties and all kinds of things that you would associate with mental conditions that I know now were obviously supported by a parasite infection, she shot herself. Now, following this incident, this is what the most unbelievable part is. Within 2 weeks of her passing, a man came into my office presenting symptoms of arthritis. His parasites were obviously a big issue as I tested them. When I got done, I kind of went over his symptoms, and I said, I see you have depression written down here. And he said, well, you know, Doc, I didn't tell you something. I tried to commit suicide here about a year ago. And he said, I played Russian roulette with a pistol, put one bullet in and pulled the trigger 4 times, and it didn't go off. And he said, finally, I decided maybe I better not do this, and I looked in the barrel, and the next bullet would have been the one that would have killed me. And he said, I realized I needed to do something for my health. And he said, that's what brought me here. He said, I've been on a holistic diet. I've been changing my lifestyle. And he said, I really now know that I can heal myself. And so, again, there was a parasite infection back of what I truly believe were his suicidal tendencies. After that situation occurred, I had no less than 10 episodes of patients with parasite infections that came into my office that all told me they were fighting with suicidal tendencies. I firmly believe, as I screen parasite infections, that anytime you have someone presenting symptoms of depression, always ask them if they have had suicidal tendencies. And some of them may say, well, I've thought about how I don't really know whether I want to keep going on, or I've thought about taking my car and pushing it off the road into a lake. Those are suicidal tendencies, obviously, but the point is they didn't act them out. Realize this is a very viable condition, and I am absolutely convinced with the number of cases that have come into my office since my next-door neighbor committed suicide that this is a big, huge red flag to pay attention to. So anybody presenting symptoms of depression, make sure you ask if that individual has ever had suicidal tendencies, and if there is a strong link between that patient with the depression and the parasites, realize this is, again, the neurotoxin. Anxiety, we mentioned previously, many patients will not have depression or suicidal tendencies, but will present symptoms of anxiety, worry, fear, just hyperactivity, as we mentioned before, as being part of it, nervousness. These are all major red flags. Anemia, the microorganisms, the amoebas, these are biggies for sucking up your blood, and they travel throughout your body, so be aware of that. So do the big worms. So many times when you have patients exhibiting symptoms of anemia, if they come and they write on their intake form that they are anemic, that again is a big red flag that there's probably a parasite sucking their blood like a vampire. And they actually call some of the protozoans vampires because they literally suck your blood. Skin conditions, biggie. If it's not fungus, by God, it's probably a parasite, and you should be screening for both, of course. But itching, especially anal itching, rectal itching, big red flags of parasitic infections. Rashings on the belly. Intriguingly, I had a man come into my office last winter who had presented a blood clot, so-called, in his vein. Went to the hospital. They immediately diagnosed him with a blood clot and put him on heparin. And his stomach broke out into this huge rash of little red dots all over his belly. Again, that is a big sign of a parasite infection when you see little rashy dots all over the belly or just a rash on the belly. When I checked with therapy localization of the parasite vial on the actual blood clot, guess what showed up? A parasite. And of course it was a larger parasite. So then I put 2 and 2 together and went, well, I gave Dr. Kim a call and we discussed this, and I put 2 and 2 together and said, well, obviously the heparin probably was a massive parasite killer, and that's the reason why his stomach exhibited and presented symptoms of the rash. And grinding teeth. Oh, wow. If your dentist says to you when he's looking in your mouth or she's looking in your mouth and they say to you, you know, you grind your teeth, are you aware of that? Another big sign. That is one of the primo signs, numero uno, of parasite infections. So we need to be aware of that. Let's go on to some other symptoms. Chronic fatigue. People are tired all the time. They have no energy. Well, when the parasite's utilizing you, you're hosting them, you're getting your nutrition in and they're absorbing it. And as a consequence of that, your body becomes more and more malnourished. And the patient will present symptoms of, gee, I have absolutely no energy. And on my intake form, I have a question that I ask them, and one of them is, in a scale of 1 to 4, how would you rate your energy, 4 being the highest? When they're down around 1 and they're telling you, this is the way I feel most days, then I'm obviously, when I screen them and see parasites, going, well, that's because, you know, that parasite's utilizing their nutrition. And as a consequence of that and the fact that the anxiety or the sleeplessness that present with many parasite infections, as I mentioned, my next door neighbor could not sleep. You go deprived for months and months and months and only getting 2 to 3 hours of sleep a night, or even less in some cases, or having to sleep periodically during the day to take cat naps. That will cause chronic fatigue. You'll just be worn to the frazzle. Granulomas. These are these tumor-like cysts that they enclose the parasite eggs or the parasite waste. And if you ever hear of a person complaining of granulomas that have been diagnosed, that's oftentimes what the granuloma is. And they can kill you. If they start launching in the liver and the kidneys and other areas of the body, doctors, obviously, because they don't look at parasite infections as anything serious in the good old USA, this goes unmasked, and consequently, until the mask is removed and you see that this is, if you can therapy localize on a granuloma with a vial for the parasite, both parasites, both the micro and the large, Paramac, it would be very all-inclusive to basically rule out the fact that the granuloma may be a parasitic origin. Nervousness and irritability we've mentioned over and over again. Again, the neurotoxin, and sometimes there's even a twitch. The person may have a twitch in their eye. Their eyelid may flutter. That's called strabismus, and that is very common among patients who have parasite infections realize these microparasites can get into your eye, and they have seen them under the microscope, and they can cause blurred vision, and the irritability also neurologically will cause the eye to sometimes flutter. So if you ever notice yourself even having a fluttery eyelid, it just kind of goes into a spasm. That's what more often than not causes it. General nervousness, legs moving all the time, shaking. You know, if they're sitting down, they're moving their leg up and down, or a nervous tic of some kind. Again, very possibly a parasite infection. Immune disorders. Well, we know that the parasite runs the immune function down, so obviously you're hosting them, and what we need to do is get rid of them and rebuild the immune function, because they will run you down to the point where your immune function is pretty much non-existent, and they can kill. They don't want you dead, but they can run you down to the point where there is no immune function left, unless some bright practitioner realizes that, hey, this is a parasite, we've got to get rid of it. And then you have to be conservative how you take the patient, because you can't overwhelm them with a parasite infection. Sometimes you have to build up and do some detoxification and cleansing of the colon before you even begin a protocol. An endocrine imbalance is a biggie. Once we run the immune function down, the endocrine system, which is kind of the turnkey for all your organ systems, the endocrines are shot, they don't work well, the thyroid gets depressed, the pituitary isn't firing as the master gland that it is, the adrenals are getting whacked, and when the adrenals get run down, then it's just like you have no buffer zone to take the brunt of anything that's attacking to your system. So here's where your endocrine formulas sometimes are needed initially to, along with your Thymasure or your X-spleen, to kind of build your system. And we're going to be discussing this when we get into Inno-Vita protocols. Next, I mentioned before vision problems. Blurred vision is a big sign of a parasite infection. We need to be very aware of that. I've even had cases of people telling me they've had floaters, and I've seen parasites back of that. In other words, horrible parasite infection, usually more the micro. But remember, again, the neurotoxins exuded by even the large worms can cause blurred vision and issues that are neurologically based and brain-based. So, you know, remember, seizures. I had a patient come in, and I'm going to mention this when we get into the seizures, that we found a parasite infection in. Digestive issues, inability to gain weight, and hunger. Wow, hunger. They're just always hungry. They can't seem to get enough food. A big, big, huge red flag of a tapeworm or a large roundworm. And realize these roundworms can get pretty big too. Usually they'll eat dinner, and within 25 minutes or less they're hungry all over again, and that's a big red flag. This is probably a big worm, and it needs to be addressed because they're not getting enough nourishment. Inability to gain weight. Again, they're eating, but they're not getting nourished, and consequently they can't gain weight because they are hosting a parasite. And again, it's usually the larger ones. However, even the small ones, if they're causing IBS, gastrointestinal distress, indigestion, digestive issues, this can be a big one. Digestive issues. Wait till I tell you this story. We had a patient present symptoms of projectile vomiting. A young girl, 17 years old, comes in, been to Cleveland Clinic. Cleveland Clinic couldn't figure out what was going wrong with her, so was going to send her to a specialist in projectile vomiting in Chicago. Well, of course, we know the medical dominion is all about treating symptoms. So let's find somebody that's specific about projectile vomiting instead of looking to see what may have caused her projectile vomiting. Well, again, she comes in, I test her with the vials, found a tapeworm in her stomach, which meant that despite all the testing they had done, these worms can bury themselves into the lumen, which is the initial material at the front of the colon and the surface of the colon. And these things can bury into the colon, and they may not visibly be seen. They're smart. Consequently, I believe she had some blocked passages in her alimentary canal that were obviously going unobserved medically. And she would projectile vomit, and within a month, when she came back to see me, the vomiting had gone from almost daily after a meal to maybe 3 times a week, and then went to maybe once every 2 weeks and eventually diminished. I had to see her about 3 or 4 months before we got it completely under control, but each time I would see her, she improved. This is a biggie to be aware of. Digestive issues are more often than not, again, the toxins, which are very obnoxious. Dr. Jack Tips, who's I would call basically a parasitologist, said that in one seminar that I went to that he feels that the toxins from parasites and the waste they exude are probably the most toxic substance in the body. And I couldn't agree with that more after 10 years of practice and seeing so many of these infections come through my door. Seizures. I had a patient that came in to see me that was presenting sudden petite mal seizures that would last just a couple minutes, and she'd drool. And she called me one day and she said, "My God, I'd never had this before. Where would this be coming from?" And I said, "Come on in. I wouldn't be a bit surprised if you have a parasite and it's exuding a neurotoxin that's affecting your brain function." And sure enough, that's what I found. We put her on a parasite cleanse. This is a toughie because these parasites, the smaller ones, and remember the neurotoxic, the toxins they exude, do cross the blood-brain barrier and can create a lot of issues with brain function. So, and let me tell you, the bigger one that we have to be careful of is, and I have seen more and more cases of this, brain cancers, where the parasite actually forms a sac in the brain and disturbs brain function and eventually can become malignant, obviously, because it's cutting off cellular nutrition and cellular oxygen. And this is more often than not what's back of a lot of brain cancers. I truly believe that. Blockages in blood and lymph circulation. Lymph is a biggie, and of course rebounding on a mini trampoline is what I recommend to keep your lymph flowing and circulating on a regular basis. And more importantly, doing Explain or Thymossure formulas for lymph drainage and Tox-X, all very good formulas for opening up the lymphatic system, which we know is kind of our waste dump for the body, that it dumps out of the cell the waste, which then goes into the blood and out through the thoracic duct. And we really want to keep the lymph clean because that is the connection we have with keeping our cells healthy, so that the nutrition is getting in the cell and the waste is coming out of the cell. The parasites, again, can block that lymph, and if you start to see lymphatic swellings under the arms or in the groin especially, even in the legs, check therapy localized, as I did with the guy with the blood clot, because you might find putting that vial on the lymphatic swelling, which could even be a cancer. It could even be a lymph cancer. You may find that what is back of that lymphatic cancer is a parasite infection, and it's usually a larger worm. Blockages in the blood we mentioned with the guy with the blood clot. I am a true believer that this could be many times the issues that start the blood in the wrong mode, and of course we use the Explain formula, which regulates the production of the good blood in the bone marrow, and also Thymossure. Itching of the ears, rectal area, genital area. Boy, I'll tell you, genital area is a key red flag that it's a parasite infection. The labia of a female, the scrotum of the male often become very itchy, and they'll scratch uncontrollably without getting any relief. The the rectal area especially, of course, because that's where the parasite exits through the stool. And oftentimes pinworms in particular, which are the roundworm, are really a toughie and will cause a lot of irritation in the rectal area with respect to itching, sometimes to the point of bleeding. Itching in the ears, another prime place. Every person that I talk to that usually has rectal itching or genital itching will also complain that they can bore their fingers deep in their ear and just itch, and they can't get the itch gone. And that's the reason why you have problems. Now, realize in the Chinese system, and this is really important to realize, that the kidneys are associated with the ears. So many more times than not, bladder infections, kidney infections will exacerbate symptoms with parasite infection in the ears as an itch. And you'll therapy-localize the parasite on the kidney points, and you'll notice that they'll be strong for the parasite infection, and oftentimes, more than not, they'll present symptoms of ear itching. Colon itching, colon point, you can put the parasite cleanse, and you'll also find at the colon point that you've got a parasite infection, and they'll talk about rectal itching. And sometimes just checking the endocrines, triple warmer point or the endocrines, you'll notice that they're strong for the parasite cleanse. That's usually the cause of the genital area. Now, what can we do to prevent these infections? One of the first things I recommend is soaking your fruit and vegetables. And I always tell my practitioners, I give them a little sheet, which has a whole bunch of recommendations. I call it healthy hints. One of which is, believe it or not, a half teaspoon of Clorox, only Clorox, not any other kind of bleach. There's something about the hydrogen atoms in Clorox when it's used in a very dilute form that neutralize and get rid of pathogens, whether it be bacteria, parasites, virus, whatever, on your sprays and whatever that may be on your fruits and vegetables. And I recommend soaking all fruits and vegetables before you eat them for a minimum of 20 minutes, and then, of course, rinsing them off. You can also use maybe a cup of white vinegar to soak your fruit and vegetables in, a cup of white vinegar in your dishwater. This would be your dishwater. So you fill your sink up, and we generally recommend a half teaspoon of Clorox per gallon of dishwater. So if you have a 2.5 gallon sink, which most of them are, it would be a teaspoon and a half. And then a cup of white vinegar, and some people even use the food grade hydrogen peroxide. Also, a cup of that in your sink water, and let it soak a minimum of 20 minutes, and of course rinse it off, and then it's ready for eating or juicing. Proper cooking of meats is a real important thing, and use a temperature, a little thermometer in your meat to make sure that, especially if you're using pork, that you have thoroughly cooked your meat. Any meat that's pink inside, don't eat, because those may be harboring parasites, especially tapeworm, or even flukes, which can be in the blood of the meat. So that's very vital to make sure that you don't eat rare meat, because that could be a real easy way to pick up a parasite infection. And when you're using meat and you're getting ready to prepare it, wear gloves so that you're not touching the meat that may have blood on it and infect you through your skin and pores. Washing hands and sanitizing utensils is a real biggie. And I recommend that we wash our hands continually, especially when you're preparing foods. And preferably, believe it or not, it's not a bad idea to use those examining gloves. Good way to not have to even worry once you've washed your hands about coming into contact. Sanitizing utensils is very important. The problem with a lot of this is once you've touched an animal, they oftentimes have eggs on their fur, and that can get into your nails. And if you bring your nails and itch your nose or put your nails near your face, near your any orifice, your mouth, your anus, whatever, you can pass an infection into your body from your animal. Really an important habit to get into. Low-carb diet. Boy, we all know that there is a great deal of evidence now that it's not the fat that we need to be concerned about, it's the carbs. Well, guess what? The parasite loves a high-carb diet, especially simple carbs. So we want to make sure we keep away from the carbohydrates that are simple and stick more with the complex carbs, the whole grains, and not even over OD on complex carbs, because carbs, remember, even though the glycemic index is lower, they still are sugars, polysaccharides, and even though those are good sugars, it's still they're a sugar. So while we want to incorporate them into our diet, we don't want to make them the major part of our diet. So while the whole grains are great, roughage, keep them to a minimal. Brown rice is a great non-glutinous grain that the parasites don't like. So that would be a good one to incorporate. Spelt's another good low glycemic grain that would be good to add to your diet. And the glutinous ones like the oat and the wheat and everything do have a tendency to raise blood sugars. They're very good for you if you're not allergic to wheat or oats, but they do create a mucus in your system, and boy, parasites love mucus. So be aware of that. So we want to keep it more with the brown rice and anything that's not white, fluffy, puffy, as they say. It creates mucus. Optimal immune function, so important, as is sleep patterns being consistent. If the immune function is good, usually the parasites don't like you. And that means that your thymus is working well, your spleen is working well, and they're keeping everything at high levels. Your sleep is consistent. You're not waking up during the night tossing and turning. And by the way, tossing and turning in your sleep or inability to sit, if you have to keep moving around in your seat when you're at work, that's also an indicator that sometimes a parasite infection may be lurking in your body, because it's that constant moving back and forth that is an indication that you're being irritated. The reason why you'll hear many people complain about sleep at night, parasites are very active. That's their busy time. Also during a full moon, be aware the parasites are much more active, and that's why you hear the word lunatic, because people that I believe have been stuck with parasite infections that are affecting their neurological system, when there's a full moon, they're worse. And I used to have my health club years ago in a building that housed it was an outpatient mental health program for mental health patients during the day, and I will tell you, when there was a full moon, they would be just rocking upstairs in the rocking chairs and very active verbally and obviously irritated. So again, this is a big red flag that it's a parasite infection. We want optimal function of organs of elimination, and again, this may be one of the areas you want to really focus on first, is making sure that that patient has cleansed out the colon, in particular the colon, the liver, kidney detoxification, and of course Dr. Kim's formulas all do that. So if you're focusing on and you find a weak liver, go with where the body wants to be addressed first. Don't try to dump areas that aren't ready to be dumped, because oftentimes you end up causing more problems than you help. I always test, and it's Herring's law of cure in the field of naturopathy. We work with what the body wants to peel layer-wise off first. So if the lymph is congested, that's what your body's going to tell you need to work with first. So you might want to go with your thymoshore or your X-spleen if your lymph is the problem with a patient. Obviously, if the colon function is showing up as a numero uno, and they're really showing the body is testing strong for, hey, let's do a colon cleanse, Coltrax, or believe it or not, permalung, because in the Chinese system, both the lung and the colon share the same channel. So many times I'll see Permalung works better than Coltrax simply because the patient needed that first. So again, we pretty much have to individualize through the vial testing to determine what the issue is, and I strongly recommend if you don't have a vial kit, do get one. So all the organs of elimination that seem to be issues, including the lungs, they may need detoxified, the lymph, the kidneys. You have to test through and see what area needs first priority and go from there. Optimal digestion, proper bacteria balance in the gut, and pH. You know, if I go back to where it all begins and ends, pH is the biggie. If your pH is acidic, and I always recommend taking a saliva pH as well as a urine pH, because oftentimes the saliva pH may be perfectly good, showing that the issues are not gastrointestinal, but they may be more eliminative. In other words, the kidneys may be under duress, in which case if a parasite infection is lodged in the kidneys and it's affecting the pH of the kidneys, you may want to address some digesta, some leptera, some pancreas, depending on where the body is showing it needs to be addressed. pH is number one. It's the first thing that goes wrong when the body starts to be under duress, whether it be a parasite infection or no matter what. You've got to get that pH up, and it should be somewhere between 7 and 7.2. 6, 7 is fine, but 7 and 7.0 to 7.2 is ideal. And if we can get you there, that's the goal, patient-wise. And I always tell people that's important. Balance in the gut, probiotics. Make sure that that gut health is good and that they're getting good bacteria. I recommend miso. Wonderful soy-based miso, fermented soy is wonderful for getting gut flora back in balance. Food-wise, sauerkraut's very good. Kefir, anything that is food that is fermented is going to be very beneficial for getting gut flora back in balance, provided they don't have fungus. Optimal digestion, of course, is primo to getting your pH in balance, and of course digesta goes the route there. Leptera, very important for blood sugar balance, and also digestion and pancreatic function, and keeping so many aspects of the body with respect to amino acids and whatnot in balance. Emotional and spiritual balance, we all know that, and I see this so often, that what comes first, the chicken or the egg? Well, believe it or not, if you're working with the acupuncture system, which most of us are, whether it's muscle testing muscles or muscle testing acupoints, the emotional patient is going to be the patient, if they're emotionally distressed, that are going to present a environment for parasites, or an environment for any pathogen for that matter. We know what tips off the acupuncture system is the emotions. You ask any acupuncturist and they'll tell you we must keep the emotions in balance to keep health up. They even know now that the pH of the body is affected by emotions. So if there's distress, bankruptcy, divorce, you know, anything, an illness of a child or a spouse, anything that can get an individual upset, that they carry with them, it affects their whole electromagnetic field. So spiritual balance, yoga, tai chi, rebounding on a mini trampoline, flower essences, a great way to get the body back into emotional balance. Pets, we all know this is probably where we're getting a lot of our parasitic infections. We need to make sure our pets are wormed. They get it because they go out into the yard, and you might say, well, how are they getting it all the time? Well, I can tell you, I have 4 dogs, and by God, I have one that loves to get into the shrubs. And she likes to look for the fecal material that are left from raccoons and opossums and rabbits and chippies, little chipmunks. So you've got to be aware when you see them starting to go into the shrubs. That's what they're looking for. Keep an eye on your animal. Don't let them get into it. You know, keep them on a tight leash. Don't let them run, because this is what they just go for. This is a natural tendency. And remember, the parasites are smart. They want the animal to keep being parasitic, so that that is an issue. Be careful of walking on carpets that our animals tread on. I think it's a good idea to keep your shoes at the front door, but if you have animals, you are tracking in dirt from the outside and they can contain eggs. Make sure that you have a steam cleaner, that you keep your carpets cleaned regularly, and you do not walk barefoot in your house, because you can pick up parasites that way, right through your feet. Wear shoes outdoors. Do not go barefoot. Leading way of picking up parasite infections, even on sand. Many of these guys coming back from Iraq have horrible parasite infections because there are literally parasites that reside in the sand. Properly balanced hydration, a real biggie. If we keep hydrated, we flush the body of waste, and whether we're carrying a parasite or whatever, we need to keep hydrated. Dietary inclusion of garlic and raw pumpkin seeds. Another biggie. Garlic in your diet regularly is a great way to keep parasites at bay. Raw pumpkin seeds, another great food to augment your diet. And if you put the garlic in even a clove a day, or if you juice, putting a clove in your juicing will go a long way to keeping parasites at bay. Chewing raw pumpkin seeds, don't use the roasted kind, use the raw. They're most effective. You can even grind garlic and raw pumpkin seeds up and give them to your animals, and that's a great way to keep your animals clean of parasites. Now, one of my favorite points is screening for parasites using Dr. Kim's wonderful kit. If you have not purchased this kit, it is so key to getting behind what is back of issues. Not only can you test all the organs and glands, which he has a formula for each organ and gland in the body, but you can also test all the pathogens. Great, great, great system. The vials can be therapy localized on the specific organ. They can be therapy localized on the specific acupoint. Alarm is what I use, or the acupoint if you just want to use the acupoint. I like to use acupoint alarms simply because I think you get a very articulating answer. The acupoint alarm in the acupuncture system is the SOS. When there is an issue beginning in the body, the acupoint alarms will be the first ones to go give you a signal, and the signal will be a weak muscle testing point. So, for example, when I'm testing the colon acupoint alarm, when it goes weak, I need to find out, is it Coltrex that's going to fix it? Is it Permalung? And this is where it becomes a little bit testy, because sometimes you have to use, no pun intended, different vials to determine what will strengthen that colon point. And it's not always sometimes what you think. Sometimes you think, oh, why isn't it the colon? Why isn't Coltrex vial fixing the colon point? Because maybe you need something else that is going to help it. So you may have to test with a variable number of different vials until you find the vial that the acupoint alarm locks with. And when that muscle test locks, that's the nutritional that you need. And remember, these nutritionals are working at the cellular level of the DNA, which is where cancer begins. It's where disease begins. The beautiful part of this vial kit is you can go down through the pathogens and test to determine what pathogen is weak or what pathogen is strong. And when you test and they're weak, that means obviously that is not going to be a problem. That's not the pathogen that's back of the issue. If they test strong and they lock, and when I test, I'm looking for a lock in the forearm, not the hand moving, but a lock where you notice as you're very gently pressing against the wrist as they're putting their hand on the vial, on the therapy localization of the acupoint alarm. So literally, they're pointing their hand with the vial in their fingers on that point, pressing it on the acupoint, just laying it on top. And when that acupoint alarm locks and your arm locks, that means that vial is what that acupoint alarm needs to either decongest the congestion in the acupoint meridian, or to feed the organ or gland specific for that. And sometimes it isn't even necessarily the organ or gland that is having a problem. It's the channel feeding it. And these formulas are so fantastic that they open the channel. So they're doing twofold. They're opening up the meridian channel that feeds the organ or gland, and they're actually feeding the organ or gland at the level of the DNA. You can't get any better than that. So I would highly recommend any of you that do not have a kit, that should be the first priority of any good practitioner. Now, we screen for parasites in a variety of ways. You can use a functional medical lab, which I use not very often because I get such good results with the vial kits that it seems totally unnecessary. But if you do, if you have patients that would prefer lab work, there are various functional medical labs, and I recommend the word functional because that means they're looking at what's causing the problem. They're looking at the function, not just, oh, we have this or that. One of the things that if you are open to actual blood testing and lab work, look for high eosinophils. That's the first red flag indicator of a parasite infection, running the immune function down. High eosinophils. Also, screen specifically for heavy metals, which draw parasites, virus, bacteria, fungus, into the body. So in other words, if you see that the body needs to have the heavy metals cleansed first, even if the parasites seem to be an issue, do that, because the body really needs to get rid of the heavy metals before it can address the parasites. You can get rid of the parasites and they'll come right back because you've got a heavy metal. Think of the heavy metals as being a magnet, just pulling all these virus pathogens, fungus pathogens, parasitic pathogens into the body, and bacteria, and if you don't get rid of the heavy metals, they'll just come right back. Screen specifically for heavy metals, as I mentioned. Also, hair analysis can determine if there's heavy metals. The Meta-X vial will be your testing vial for the heavy metals. Regular exercise is so important when you're getting rid of a parasite cleanse. And the one that I've done the most research, I was written up in the Philadelphia Inquirer and also the Miami Herald for my research in energy medicine with respect to exercise. And what I found is we used an EAV machine, which is a machine that actually tests the acupuncture points. And we found pre- and post-testing, if we put, we had 25 controls that we tested pre- and post on an EAV machine prior to putting them on an exercise program. And at the end, we had them do do-in, rebounding on a mini trampoline, and Tai Chi. And when we electromagnetically tested all the acupoints and then had them do these protocols of rebounding, Tai Chi, and do-in, which is a Japanese form of yoga, 3 times a week, they presented wonderful test results with a 78% improvement in their energy screening of the organs and glands. And these EAV machines actually can show you, like preliminarily, if you're below 45% on your Qi testing. At the end of the research study, they were all up around 50 to 60%, which was showing that their energy levels in the organ and glands, meaning their Qi flow, had dramatically increased. And remember, in the acupuncture system, Qi flow correlates to health. So if the Qi is not congested or impeded and it flows through the meridians, you're healthy. If it's blocked, if it's congested, it affects the organ or gland that it's feeding. And then we need to look back and forward to see whether it's the problem behind that, the energy going forward or the energy that may be backing up. This is real important, rebounding to cleanse the lymphatics I mentioned earlier, to increase the dead waste of the parasites, and boy, that's very toxic and can cause a lot of problems. Many times patients will present nauseousness high up under the rib cage, left lobe of the liver. Our Tox EX formula is very good for eliminating left lobe of the liver toxin buildup, as is Livergy. And that would be a good one also if you're getting a histamine reaction. Sinusitis, remember. Anytime you're getting a toxic buildup from dead parasites, wherever your weak link is, you'll exacerbate symptoms. So if it's emotions, depression, anxiety, sleeplessness, that'll get worse. If it's sinuses where parasites love to hide, you'll have a sinus infection that may all of a sudden seem to release and come down, and that's nothing more than the cleanse, but it's probably also due to a backup of the dead parasite waste being released, and it's like a sponge. It absorbs so much waste, and it gets toxic, and the body can't remove it fast enough. So by neutralizing the toxins via the Toxi-X or the Livergy, you go a long way to cleaning up the body, as well as supporting the immune function. Now, compliance is crucial. If your patient is not going to complete a parasite cleanse or not going to follow the cleanse if they get sick and back off, and you don't help them with a Toxi-X or Livergy or Kidney Clear, whatever they may need to help open up the channels, and they're not willing to follow it, you can just tell them that there's nothing more you can do for them, and you must make sure they do not stop the cleanse. Sometimes the healing crisis can become overwhelming. That's why it's so important to screen them and see what the body wants to tackle first and go with first, second, third. Sometimes the parasite cleanse may be 3 layers deep. Make sure that the initiation of the cleanse is preceded by a general cleanse of organs of elimination. We mentioned that earlier. Making sure that the colon functions good. If their colon's backed up and you put them on a cleanse to exit out the colon, it's just going to exacerbate symptoms and make them more constipated or create a diarrhea situation. So we want to make sure that we get, again, test to see what the body wants to deal with first, second, third, fourth. And as the parasites surface, because peel and heal, that is the point at which we want to address the parasite. I always recommend half the body weight you drink in ounces of water for proper hydration and for toxic elimination. Also, chlorophyll in water, 1 tablespoon a day. Really good way. Just put a tablespoon of Clorox in your water, in your jug of water, or teaspoon in your little 8-ounce glass, and sip your water throughout the day with that. That'll neutralize the toxins and also help hydrate. If you don't hydrate, especially when you're detoxifying, you'll get sick. And I've had many people call me and say, gosh, I am really sick, and I'm drinking all of this water. And I'll say, well, how much water are you drinking? And they'll say, well, I'm drinking 4 glasses a day. And I'll say, well, how much do you weigh? And they'll say, well, I weigh 175. Well, 4 glasses a day is not going to be near enough. So again, a minimum of half your body weight in ounces just to keep your system hydrated, and even a little more if you're trying to detoxify and cleanse. So juicing, by the way, is included in hydration. So if you're juicing every day, at least 16 ounces is recommended of juicing to really get any benefit. Add that as your water, because that's water from your fruit and vegetables. Support and build your immune function. We mentioned this prior to a cleanse. If the person is a patient of a degenerative disease, it's very important to make sure that their immune function is tip-top, because you put them on a cleanse and they're already weak, especially if a cancer patient is coming into you. You really want to make sure that you go conservative. Even CHS patients, congestive heart failure, if you start dumping into their body, their lymph becomes congested, and you only create more congestion in the body, and congestion for a congestive heart failure patient would indicate you're putting them into congestive heart failure. Elderly people that have swollen ankles that have CHF you really want to be careful with. You might want to ask the body, for example, how many capsules of the parasite cleanse they need, because the dosage on the bottle may be too much for them. Same thing with a child. Be very careful of dosage until they're ready to do 2. They may only need 1. Same thing for small-framed, tiny people. They may need not as much. So be aware of that. So based on their immune function and the support they need, you have to go by that. Diets should be devoid of sweet foods. Carbs should be restricted. We mentioned that earlier. Sweet foods, parasites love. If you're going to do any sweets at all, fruit, minimize too sweet of fruits. Pineapple is a good fruit because it's loaded with bromelain. So is papaya. Very good fruits on an empty stomach because they will, because of the proteolytic enzymes, the papain and the bromelain, they will digest the dead parasite waste and they'll digest the parasites. So that's one I like. But prunes and raisins and all those kind of foods kind of minimized because of the fact that parasites really like the sweets. Of course, no candies, breads, pizza, any of that during a parasite cleanse. Really minimize or completely restrict. Juicing protocols for detoxification are really vital. One I like is 10 ounces of carrot, 3 ounces of beet, and 3 ounces of cucumber using a 16-ounce measuring cup. Run about 5 large carrots or maybe 8 or 9 smaller carrots through the hopper. Wait till that juice goes up to 10 ounces. Then in small cut pieces, add your beets until it goes up another 3 ounces. And your last but not least, your cucumber. And cucumbers, 3 ounces of cucumber will take it up to 16 ounces. That is a great way to detox the kidneys and the liver. I love that particular one. Also, 10 ounces of carrots, 6 ounces of spinach. Wonderful for addressing pH and colon issues, which obviously we need to work with. So I recommend the 16-ounce recipes, one day, one another. Again, 10 ounces carrot, 3 ounces beet, 3 ounces cucumber one day, 10 ounces carrot, 6 ounces spinach. It's got to be raw spinach, not cooked, through the juicer hopper. Nutrition then to assist in neutralizing toxins. Beets are wonderful for helping clean out the liver, and juicing is a prime way to neutralize toxins. Those 2 recipes in particular. Regular exercise to increase circulation during the protocols. We mentioned that. Rebounding on a mini trampoline, probably the best way to eliminate toxins out of the lymph and keep the circulation of the blood running through the body and detoxifying. Also, brisk walking, swimming would be good. Screen for location of parasite infections. We mentioned, especially with respect, if heavy metals seem to be an issue, we want to eliminate them first. If heavy metals seem to be an issue, we want to eliminate them first. Support organs harboring infection. Boy, I love to, when I see somebody with a parasite infection, take that parasite cleanse and go around the different organs and glands and therapy localize to see if where that particular organ or gland, which one may be harboring the most parasites. And sometimes after I've seen them even 2 or 3 visits and a parasite infection is still presenting and they're locking, I then go and find that most of the organs and glands are pretty clean, but maybe the liver still has an issue. So sometimes what I'll do is pair the parasite, Paramac or microsite with the Livergy formula if it's the liver, or if it's the pancreas, pancreose and Paramac or microsite. Great way to combine and kind of target that particular parasite where it's hiding out. And that sometimes eradicates the issue that may be continuing on and on. Make sure, again, they're drinking lots of water, because once you start an organ-specific parasite cleanse, they may exacerbate detoxification very quickly, and you need to be supporting with the ToxEX or Livergy or whatever you're doing with it. Support organ harboring infection, we mentioned drainage, we mentioned target specific parasite formula with organ, we mentioned. I'm finding this is very effective. Target the lymphatics. Now we're going to talk a little bit about, is closing here, what specific Inno-Vita protocols are the most effective for each organ and gland. Targeting the lymphatics with Thymossure, X-Spleen for proper drainage. We mentioned these are 2 biggies. Again, test to see which the patient needs. Sometimes I'll find X-Spleen works better on the thymus than Thymossure does. So in other words, don't always assume that just because that organ or gland is weak that the organ or gland function formula is the one you need, because it may or may not be. Be aware of that. So sometimes I'll find Thymossure works on the spleen better than X-Spleen. Sometimes I need both of them. So again, therapy localize and test with various vials. Next, support liver, kidneys, colon, and lung. These are crucial for detoxification. I mentioned before that permalung may be what you need to clean the colon out, and vice versa. Coltrex may need to be used to clean out the lung and the upper respiratory and sinuses. I see this more often than not. Or sometimes I'll have them on a perma-lung formula, and they'll present symptoms coming back a month later with sinusitis and issues in their upper respiratory, and I find that Coltrex is now needed to really clean up the act. Kidney Clear is going to detoxify and cleanse the kidneys and the bladder. Livergy, obviously, the liver is very, very important to keep clean throughout, and that's one that you may need periodically. Some Livergy also for the gallbladder, Galastic isn't what you need. So again, mix and match, as I call it. You must incorporate a ToxyX, so important in all parasite cleanses. But again, sometimes I'll find the patient is not strong for that. Instead, they need Livergy or Kidney Clear or X-Spleen or Thymossure for lymphatics. So again, individualize the protocols based on what that layer needs to be addressed. But ToxyX is the #1 if somebody calls you and says, you know, I feel like I have nauseousness, I'm breaking out, whatever the symptoms may be to them that are weak symptoms that they presented on their intake form that may be their problem areas, they will get worse, the symptoms will exacerbate without ToxyX. If they're presenting symptoms after you have seen them, that would be the first one in the repertoire. Remember, pH and digestion are so important, as is glucose balance. Parasites love sugar. The pancreas is really important, as is the Leptera from the glucose levels level and the glycemic index not spiking. And we know that the insulin levels will spike if the glycemic index foods are, if you have a high index, then it's going to cause the insulin to spike. So pancreas and Leptera are just awesome for keeping you in that low glycemic level. And Digesta also for pH and sugar balance and proper assimilation and digestion. Vital for issues, especially with patients presenting issues that are basically digestive in nature. Do not cleanse parasites if a person is pregnant. That can very much affect the fetus or the embryo. And you want to be very careful, too, if you have a health-compromised patient who is either elderly, too young, or, for example, in the final stages of cancer. And that just occurred to me a couple weeks ago. I had a patient come in who was completely bald, weighed 90 pounds. She was a woman. Last stage, gave her a month to live, and she comes to me, and the first thing I did when I tested her is told her that I found a microparasite infection involved in her cancer, but that was not going to be what we were going to start her on. I was going to give her something to build her nutrition. Chemo and the radiation had really depleted her of her immune function as well as her ability to assimilate. So I got her on Leptera and worked on digestion and thymus and whatnot to build her up. So you would never, ever want to put any cancer patient on this unless they were in really good shape. And again, individualizing their based on their vial testing. If their body says they can handle it, then obviously they can get rid of the parasite and do so, because sometimes that parasite removal will drastically improve their life expectancy as well as eradicate the cancer. Any neurological imbalance, tremors, walk the gait if the gait changes. Again, we have to realize that the medical profession does not look at causations. They look at symptoms. They treat symptoms. They treat cancers. They treat Parkinson's. They treat lupus. They oftentimes do not look to see what's back of them. I will tell you, I have found many MS patients, MD patients, with parasitic backgrounds or heavy metal backgrounds. In other words, you find the heavy metal issues or the parasitic issues back of their MS, their MD, or Parkinson's. So absolutely, we have to get away from the idea of cancer, rheumatoid, lupus, and we have to look at pathogens, numero uno. That's a wonderful question, and they can put their feet on top of a rebounder, and I had this experience when I had my health club years ago. I had a gal come that I'm looking back at it thinking she probably had a real severe parasitic infection in her lymph, and she was a young girl. She probably weighed almost 300 pounds. She had gotten so heavy from excess lymph fluid that they didn't know what to do. And they kept draining the lymph out, and she just swelled back up. And she came to me, and I got on a rebounder, and I had her put her feet on the rebounder while I bounced. And the electromagnetic energy from that rebounder increased the fluid release in her body, and her practitioner, not practitioner, but the person that brought her in, that was with her, her aide, said she could not believe when they got her back home the amount of fluid that she urinated out. So be aware that, yes, they could use a swimming pool, if they could even get in water and keep moving, if they had some, like a life preserver on and could keep moving with their arms. In addition to the rebounding, those would be the two things I would recommend. But I can tell you the rebounding, having somebody rebound with the patient that may be in a wheelchair bound, is very, very effective. In other words, it's as effective as if you were rebounding yourself. I would look for heavy metals because of the vaccinations. In other words, oftentimes what you'll find is a vaccination will take place, and then sometimes very shortly afterward, or sometimes months later, exacerbation of new symptoms appear that were never there before. So you always want to look for the heavy metals back of everything. As I mentioned before, they're the magnet for all kinds of issues. And again, we don't want to look at disease per se as diabetes. We've got to look to see what's causing the diabetes. And believe me, parasites can even cause that, because they can come in and affect the pancreatic function if they're lodged in the pancreas, or the stomach. They can affect digestion. So again, we have to get rid of this idea of diseases. We have to look at functional medicine. What's causing the problem? That's why it's so important to screen. And again, heavy metals would be the first thing I'd be looking at for the vaccinosis. You know, many of you, that mercury is laced in a lot of these old vaccinations, and some even of the new ones. Once that mercury is in your body, it can cause a lot of problems, as well as in your teeth. So be aware of the fact that the heavy metals are oftentimes behind these issues. You sure could, and that's such a good question, and that was one of the first questions I had. Believe it or not, this was a naturopathic recommendation. Now, I understand that when you use the Clorox in dilute amounts, which we're talking here, we're not talking cups of it, we're talking a half a teaspoon per gallon of dishwater, that the hydrogen atoms exhibit a wonderful ability that it's very, in other words, it's not affecting the physical body in a chemical way. Now, if you're really sensitive to chemicals, yes, I would probably recommend using either food-grade hydrogen peroxide or the vinegar or the grapeseed extract. But generally speaking, you don't really have to worry about the Clorox unless you're extremely sensitive, because yes, it's a chlorine, but it's the way it was explained to me, it's in such a different atomic structure when it works more in the hydrogen base that it does not affect the physical body in any negative way. Either to take silica or something with silicon. Silicon is in goat's milk, also oat straw tea, which you can purchase in a health food store, and it looks like literally like straw. It's called oat straw tea. You'd put it in a one of those tea balls and let it soak in your hot water and drink it. Also, I would recommend electricity on the bone, and you can get that usually through the chiropractor, the TENS unit, where they actually give you electricity. That will also really quickly heal bones much quicker. But goat's milk, as opposed to any other kind of milk, the cell salt silica, and the oat straw tea. And if the wonderful thing about Dr. Kim's CalComp formula also is that it's also looking at the thyroid, which is so important for the metabolism of calcium. There's thyroid support, thyroid form code in there, so that you're getting that balance for the bones, so that the calcium is not going out of the blood into the tissue, that it's going to go to the teeth and to the bone where it belongs. I sure do. What we do in the acupuncture system is realize there is what we call a meridian clock, and 1 to 3 a.m. is the liver time. So that's when the liver is most active. Many times what I will do on an intake form is I ask them, what time of day are your symptoms more predominant? And if the symptoms are predominant in the middle of the night, say 1 to 3, or 3 to 5, 3 to 5 would be lung time. So I would assume, based on this, that the issue that she is dealing with is probably liver-related, simply because if it's up until 3 o'clock, that it would say begin, say, around 3 o'clock, it's liver. If it's 3 to 5, it could still be liver involvement, but more likely lung. And that's a gigantic help in realizing where you need to focus too, knowing that time period. But because the liver is on the right side, I'm thinking it's more the 3 o'clock liver time than anything else, because obviously the lungs are, you know, up high as opposed to low, and the liver is on the right side, and we always look at feeling the liver would be right underneath the right breast, essentially. So hopefully that will be where that practitioner might want to focus on with the patient. Again, always ask times. I'm so glad that question came up, because the meridian time is crucial to the function. And oftentimes when they'll tell me that's the time they have a problem, I will know right away that's probably the organ or gland that's the problem, but it may again be the energy preceding it, because in the Chinese system you have to go backwards sometimes, and it might be the meridian previous to that that's not functioning and is congested and consequently causing the problem. So we have to look at the variables of the muscle testing. Again, the muscle testing and the vial kits are absolutely essential to be a really effective practitioner.